So, as we continue discussing the factors that influence medical trauma, the third factor, or really it was the second factor, but third factor is the diagnosis and procedures that are performed by medical staff in the medical environment. Now, I already went over these. This is going to be that video where I talk about the levels of medical trauma. So when it comes to the diagnoses and the procedures, the different levels are really what influence the likelihood of experiencing medical trauma. So go ahead and go check out that video. And this video then is going to be about factor 4, which is the medical environment. So the important thing to know about the medical environment is that while the medical environment is not usually the biggest slice of the pie when it comes to medical trauma, that there is a consideration that needs to be made that does influence our level of vulnerability with regard to medical trauma experiences. This consideration is largely around the context of the person in the environment or the people in the environment. So what that means is there is going to be a difference in the medical environment of the level of vulnerability of, let's say, medical staff versus a patient. Medical staff spend lots of time in medical environments. They're trained in them. They go there for work every day. It's also a huge part of their professional identity. So essentially, medical providers and medical staff have been contextualized or habituated to the medical environment and all the different aspects of it. What this means is it reduces the provider's level of vulnerability. They're used to seeing a lot of different faces. They're used to the types of procedures. They're used to all the different nuances that come with being in that environment. And it is part of their day-to-day value system, identity system, their professionalism, their training. All of these things help make them more and more comfortable being in that environment. Patients don't have that. So what this means is patients are the opposite. They're decontextualized. They're not habituated to the environment. They are not used to the context of seeing different faces, having people poking and prodding at them who they don't know. They're not used to all the nuances, the language, everything that comes with being in a medical environment. So on top of the fact that they are not habituated well to that environment, they also are in a position of vulnerability. They're there seeking help, and they're in a position of powerlessness. So what this means is that with being a patient, you're decontextualized, you're not habituated to the environment, you're disempowered, and you're vulnerable. All of these things set the stage for experiencing something as traumatic in that environment. So put this all together, and you've got the medical staff, the medical environment, the diagnoses and procedures that you might experience, and your own personal individual traits, stressors, and everything else that you bring into it. All of those things together make up the medical trauma puzzle that ends up getting put together at the end with how you experienced it, what happened, how you were treated, etc. But there's a fifth factor that I want to introduce, and I'm going to go over that in another video, that is the social, cultural norms, beliefs, patterns, laws, and policies at the time, including the political climate. So I'm going to talk about those things in a separate video and how those can influence a person's susceptibility to medical trauma.